is Natasha Graham. I'm the council liaison for the Chiltern branch, and I'm here to host your session this afternoon for what promises to be a highly inspirational and thought-provoking session. Thank you all for joining us today. It's going to be an interactive session at times, so if you have comments or questions, please pop them into the chat. I think we can all agree that the last 2 years has been somewhat of a roller coaster, and that if there's one thing that the COVID pandemic has shown is that not only can organisations be resilient, but it's also highlighted the critical importance of mental health. So last year in particular, 17 million working days were lost as a direct result of stress, anxiety and depression. So recent surveys by Mind suggest that 2 in 5 employees experienced a decline in their mental health over the pandemic, with cases of anxiety and depression having doubled over that time period. And this is further supported by research which was conducted by the Mental Health Foundation and other organisations, which suggests that we may now be facing a new global pandemic of poor mental health, with the Office of National Statistics reporting that cases of depression and anxiety are still 10 to 15% higher than pre-pandemic levels. So in response to all of this, yesterday, the Health and Safety Executive launched its Working Minds campaign, aiming to help businesses and organisations to recognise the signs and symptoms of work-related stress. While Working Minds is predominantly targeted at small businesses, the Health and Safety Executive are calling for a culture change across Britain's workplaces so that psychological and psychosocial risks are given the same treatment as physical risks. So today, Chiltern will take you on a journey through mental health and wellbeing, and we are lucky to have 3 incredible speakers with us today. Firstly, James Knott, who is currently Health and Safety Manager for SJ Eastern. He will take you through a journey of his incredibly personal but inspirational story, and that is entitled From Surviving to Thriving, Malnourished to Manpower. Secondly, we have Gareth Salisbury, who is the UK Sales Manager for D.tec International. His current role includes creating bespoke proposals, drafting robust drug and alcohol policies, and he will be offering advice on developing strategies to detect and prevent addiction to drugs and alcohol in the workplace. And last but by no means least, we have Kate Field to take us through the ISO 45003 to assess and manage social and psychological risks to health, safety and wellbeing. So Kate is the Global Head of Health and Safety and Wellbeing at BSI, driving their global strategy for creating a safer and healthier workplace. She's an ambassador for cultural change that puts wellbeing, equality, safety and health at the forefront. And she inspires her colleagues and stakeholders globally to make a difference. She has over 20 years industry experience in health, safety and wellbeing, which makes her a recognised consultant, trainer, lecturer and speaker. And prior to joining BSI, she was Head of Information Intelligence for IOSH, leading on health and safety research strategy and technical content globally. So thank you to the 3 of you for being with us today. So today's agenda, we've just gone through the welcome and we will run through now. Today's title is It's All in the Mind, or Is It? So we'll start with James and then we will run through with Gareth, finally finishing up with Kate. They will take questions at the end of their presentations and I will monitor the chat for those questions and pose them if necessary. And then we hope to wrap those up by 2:15 this afternoon, at which point we'll give you some branch updates and wrapping up the afternoon, closing at 2:30. Okay, so moving on to our first speaker, I will hand over to James to run you through his story.
Can you hear that?
Yes.
Before we start today, I'd like to say a few words. I suffer with anorexia nervosa, and what I'm going to talk about today may be triggering for some individuals. So if you have suffered with anorexia nervosa in the past or a mental health illness, particularly with eating disorders. And while some of the content may be quite triggering to some individuals, there is plenty of support available out there to help you. Throughout today's session, I will be signposting you where you can get support from. I hope you enjoy today's talk.
We can all do things for our mental health.
I talk about my worries.
Get a free mind plan to see what works for you.
Oh, it's you. So you decided to come. You're probably thinking, James, why are you on the floor? It's funny you say that, because you know what? 6 years ago, I suffered with anorexia nervosa. It's a serious mental health illness where you try and ultimately lose as much weight as possible. I didn't want to be here. I was ready to go. I was ready to fade away. I'm standing here today to talk to you about how you can improve your life, improve your situation. I had to hit rock bottom before I realised what I had. The thing is, you're only a failure if you don't get up. Hello, this is my story. I'm turning wounds into wisdoms.
Tide of emotions weighing you down. The fight is all gone from your eyes. The dark skies will open, but you're gonna drown, waiting for lightning to strike. So just look around and you'll see yourself in places you don't even know, and you'll find out that you're not alone. If you've ever felt like you're falling apart, raise your hand, raise your hand. And if you've ever felt the life's breaking your heart, raise your hand, raise your hand. Everyone bleeds and everyone hurts, but if you think you're alone, it just makes it worse. So if you've ever felt like you're falling apart, raise your hand, raise your hand. Afraid at the edges, trying to take cover under the mess that we made. Through all of this madness, the damage we suffer is the one thing we can't escape. So just look around, you'll see yourself, faces you don't even know, and you'll find out that you're not alone. If you've ever felt
Up. So I'm talking to you today because I overcome a serious mental health problem that otherwise could have ended horrendously. I'm talking to you because I fought my battles and challenged those voices in my head. There was not one moment where I thought I was going to survive. People around me pushed me and were urging me to get better. But in all honesty, I simply not to help myself. I was constantly fighting those demons in my head. 1 in 4 people suffer from ill mental health. 1 in 5 have suicidal thoughts. 1 in 14 self-harm. And 1 in 15 people will attempt suicide. But sometimes it can be invisible. So today, I am shouting out to everyone on this call who battles a war within their mind every day. Never forget, that takes real strength, courage, and bravery. But before I tell you a little bit about my story, I want you to try this psychological trick wherever you're dialing in from today. So if you are distressed, feeling anxiety or negative emotions overall, just do this. So I want everyone to do it with me. So firstly, lean back in your chairs Tilt your eyes slightly backwards and in your head, and you will instantly feel a relief of calmness. Now, this is due to a changing of brainwaves and has been practiced in meditation for thousands of years. I wish I had learnt that one earlier on. I think it's important to understand the difference between mental health and ill mental health, because every one of us on this call has mental health, and 1 in 4 of us will experience some sort of ill mental health throughout our lives. We all have mental health just like our physical health, and the two really go hand in hand. We can see when someone's got a broken leg or a broken arm, but it's not always so obvious to understand what's going on in someone's mind. But taking care of our body isn't just good for your physical health, it also can improve your emotional well-being. And I believe there are 4 key components to this. This is nutrition, movement, relaxation, and my favourite one, sleep. Now I'm going to go into a little bit more detail before I start to tell you a little bit more about my story. So starting off with nutrition. It's simple. A healthy, balanced diet promotes bacteria in the gut, and that helps feel-good signals get to the brain. Ideally, we should be eating 5 servings of fruit and veg a day. Now, I'm 28 and I still suffer with that problem. The second one is movement, and this is also known as exercise. So moving our muscles produces endorphins, and this chemical we produce helps the brain deal with stress. We should be aiming for at least 30 minutes of movement a day. Relaxation. Mentally unwinding can reduce stress and anxiety, as well as increase energy and focus. Just like that trick we tried a minute ago, that is a form of relaxation. Now my favourite one, sleep. A good night's sleep helps lower stress, improves concentration, and boosts emotional stamina. We should all be aiming for at least 7 to 9 hours sleep a night. Now, I know that's not possible, but sometimes I even still struggle with that. I'm always on my phone before I go to bed. Something I really have got to cut out. I remember that morning all too well. I had a doctor's appointment booked at 7 a.m. It was in August 2015. I already went out for my long hour walk. And my mum, she wanted to come with me on this doctor's appointment. And what the doctor told me that morning was the start of something new. At such a low weight that I was a risk to myself and others. I could no longer drive. I had to declare my licence for DVLA. And the doctor said to me, I have the power to section you under the Mental Health Act. Luckily, and thank God, it never got there. It was certainly a wake-up call for me. Little did I know, I was going to be off work for 8 weeks. I hit rock bottom. I didn't know what to do with myself. I knew something had to change if I wanted to go back to work and to drive again. Yes, that involved eating, something I was so fearful about. But the traumas at a young age, being bullied at school, I was that chubby child. I would often get called Bacon Boy, and in the space of 14 months, 3 grandparents died around 2015. The obsession of becoming thin just spiraled out of control. I enjoyed being hungry, and the one thing I could control was the food I ate. Due to my low weight of 7.5 stone, I was entitled to 36 weeks of cognitive behavioural therapy. This is also known as CBT. Together, I would work with my therapists and understand my distraught thinking around food to hopefully make me want to eat more. There were times where I was still in denial. I'm not going to lie. I would often wear these brown combat trousers and I'd stuff stones in the pockets just to add a bit of weight on when I got on the scales each week when I was weighed. But that voice in my head, it was still winning. And when I did start to eat, I was like a kid in a sweet shop. I went from restrictive eating to binge eating. And the weight was piling on. And people would often say, "Oh, James, you look good. You must be better now." But this was far from the truth. I felt I was eating to make others happy and to go back to work. My mindset and the thought process was no different. I was still struggling. And the therapy sessions, they were drawing to a close, and I made sure I had things to look forward to. I started travelling around Europe. I would often have long weekends away. I visited Czech Republic, Prague, Lisbon in Portugal. I even went to Krakow in Poland. And during my time there, I even visited Auschwitz, which was certainly an eye-opener for me. Hungary and Budapest, Bulgarian Sofia, and Latvian Riga, to name a few. I've really missed travelling over the past years, and the pandemic, as we know, hasn't helped with that. But the one thing my eating disorder has taught me is to be more resilient when challenged with difficult circumstances. I can now show great empathy towards others who face challenges and experience ill mental health conditions, which has been made easier through my past events. As a health and safety practitioner, it really is true when people say health is wealth. Imagine if you were a billionaire, and you could buy the best supercar out there, a yacht. You could even spend your time abroad, live in the sun, at your house in Malibu, living your best life. You could even own your own spacecraft, couldn't you? You could fly to space whenever you wanted to. And that night, you go to bed and you smile. And in the morning, you wake up and you're sicker. And you become sicker and sicker. And after a while, you realise that what you owned becomes worthless. Because it is said that the sick person only has one wish, and the healthy person has thousands. So if you're healthy today, cherish it. Cherish it. Because it is the greatest richness of life. So when you next hear the word mental, don't think of the bad man, think of me. Thank you. Tony, on the next slide, please.
Did you still see him? Yeah, tell me about it.
Oi, oi, Jonesy. Saturday will go down in history. 4-0, mate. Oh, man, I'm still aching from the weekend. I need to swap with the keeper. What'd you get up to?
I spent the last 48 hours staring at a wall. Linda, you know, she's gone and left me. The banks, well, they're moving in on the house, and, you know, my daughter, she barely speaks to me anymore. To be honest with you, mate, I think I'm this close to ending it all.
Hello, Gary. Good weekend?
Yeah. Pretty quiet. Just pottering, really.
Yeah. You look pretty exhausted. To be honest, I'm really worried about you, mate. You're not the usual lively Gary we used to having around. You know you can talk to me. I've been there myself a while back. You should come down 30 this week. We're always looking for extra heads.
No.
Go on.
All right, maybe. I suppose you think you got the skills then, yeah?
No, mate. I'm crap. Actually, we're all pretty rubbish. But you know, it's a good laugh.
Yeah, go on then.
Good man. Anyway, 4-0 with Jonesy, right? He's absolutely livid.
Was he?
Nutmegged him twice, and then he just got onto a total strop.
Easy done though, right?
Easily done. It'd be great, mate. Put 5 past Jonesy this week, eh?
Just remember, it's okay not to be okay. Don't suffer in silence like me. There's support out there.
Tell us a little bit about your story.
When I was young, I was going to school, living fine, well, generally quite happy. However, things changed over time. I stopped going to the gym and I noticed that I was reducing my food intake, so I wasn't eating properly. Through this, over time, it became anorexia. It was really hard and very difficult because I thought I wasn't alone. I was in control of my eating and it was very difficult.
How hard was it for you to get help?
It was quite hard to get help. It was only until I was at rock bottom where actually I wanted to help myself. It was only until I couldn't go to work, lost my driving licence, that I needed to sort myself out. And I knew I wasn't in it alone. I knew I had family, friends, support around me to get where I needed to be, to a much healthier, better state mentally and physically.
What things did you do that supported your mental health?
Things that supported my mental health and well-being were my family, friends and support around me. I also attend a regular self-support group, and this is based in Stony Stratford. This is Balanced MK, and this also helps others as well as myself with any type of eating disorder.
If you didn't get help, what do you think might have happened?
If I didn't get help, quite frankly, I don't think I'd be sitting here today. I probably would have died. I had suicidal thoughts, depression, and I didn't want to be here.
What tips would you give to young people?
Now, as a recovered adult, I think it's important to seek help, but also you're not in it alone. You're not on your own. There's people there that are there to help you.
Is that it?
That's it. So yeah,
I'll stop share screen. You don't need it up now, so you can talk direct then. Is that all right?
Thank you, Tony. Yeah. So hopefully you enjoyed that. I appreciate there might be a slight delay on Zoom when you're trying to do videos, but I'm willing now to take any questions. So should you've got any questions regarding what I've been through, I'm completely open and honest. Please feel free to drop it in the chat. If you want, I could also put my details in the chat. So feel free to reach out to me. I'm also on LinkedIn and I can share my email address as well. But if you've got any questions, please feel free, fire away, raise your hand. I'll be willing to take any questions before we move on. Thank you.
Whilst we're just waiting for people to come forward, I have had one question. Somebody was really interested in the cafe scene video that you had in your presentation and wondered if that was a resource that could be made available.
Yeah, absolutely. So if you do go onto YouTube, this was actually introduced as part of the Crossrail Moving London Forward. Right. They got a range of health and safety campaigns, and this was a one with regards to mental health and mainly with men in construction. But that is the Crossrail Moving London Forward campaign. So they're freely available on YouTube.
Okay, thank you.
You're very welcome.
Really powerful, moving story. I do have one question just before we wrap up. I've not seen anybody put their hands up so far. Obviously, it's said that it's very difficult for people who suffer with eating disorders to know when they need help. What was the defining moment for you? When did you realise that you actually did need that help?
Yeah, I suppose for me, you're so in denial that you think everything's okay, and it was only until really my kind of nan and my parents really started to see that I wasn't actually eating properly. I actually lived off dried cereal and fruit for more than 2 years, so I was almost isolating myself away from the family at meal times, and they could see that the weight was coming off, and they knew something wasn't right. And it was only until they kind of pushed me to see a doctor, although I was adamant everything was okay. I don't need help. I don't need support. that was really the kind of the turning point for me. But believe it or not, just touching on another stat there is actually 94% of people today who have an eating disorder aren't actually underweight. So it just goes to show that it is such an important topic, and it's not always clearly identifiable just by looking at somebody with regards to their weight.
Okay, I'm just reading the chat. There has been a question, but I think that's more to do with where people are in a bad place and how to open up that conversation and what we can do to get that individual to open up. Without trying to cut everyone short, I know we are very short on time, so I'm wondering if maybe we take that offline and we provide you with all the questions so that you can then get back to people afterwards.
No, absolutely, I'll be all for that, so that's not a problem.
Okay, if anyone does have any further questions for James, please feel free to put them in the chat. We will take a extraction and we'll make sure that James gets all the questions and he can provide answers for you following the session. From what we will, our next, we will probably need to move on to our next speaker now. Sorry, that was a really moving introduction, and you know, I don't like to cut things short, but I'm very wary that you're all kind of bound by time. So, thank you very much. Moving on, then we have Gareth Salisbury. If I can ask Gareth to come forward and start his.
Sure, thank you very much. Yeah, really inspirational stuff, James. I listened intently throughout, so much appreciated. Thank you very much. So we may well, if you're open to it, use you if possible. There's a real crossover with obviously what we do with drugs and alcohol into obviously your topic as well. So really inspirational stuff. Much appreciated there. Yeah, so obviously with what I'm presenting today, it's slightly different, but hopefully entirely beneficial as well. It's from a workplace perspective. Obviously, I've not gone through sort of similar circumstances, anywhere near the circumstances as James had, but from a professional perspective, hopefully I'll be able to give a good insight into what I see when engaging and talking to companies. And hearing lots and lots of stories from a professional perspective and talking to lots and lots of organisations. So hopefully be able to give you some insight into preventing addictive behaviour. And I will obviously give a little bit of insight into what we've seen sort of throughout COVID. So my background, I've been involved with workplace drugs and alcohol testing for about the past 12 years. From a variety of situations, really. I've been involved with building policies, but primarily providing support, educational resources, and ultimately we also help out with implementing drug and alcohol screening programs as well. One of the core devices that we supply is the drug wipe device, which is involved with roadside testing for drug impaired drivers as well. But that's the crux of what our organisation does. But obviously here, what I'm here for today is just to give it a bit of background knowledge of obviously addiction and how to help support employees and how to help within the workplace. So addiction, what is it? So with regards to drugs and alcohol, obviously it's defined as not having control over what you're doing. Taking or using something to the point where it could be harmful to you. So there's a whole host of reasons why addictions begin. In the case of drugs and alcohol, clearly people will begin taking those substances because they ultimately make you feel better, both physically and mentally. They can be enjoyable and obviously create an urge to use the substances again. Generally, illegal drugs fall into three main categories. So you've obviously got stimulants, the likes of cocaine, amphetamines, which will speed the central nervous system up. They're going to ultimately increase your heart rate, increase your breathing, and will affect the digestive system as well. So basically, the reason people will be led towards taking stimulants is because they're going to increase confidence levels and ultimately make you feel like you're more confident and make you think you're capable of doing things maybe that you wouldn't be able to do without taking them. So that's why people go back to take them again and again, I guess. The second type of drug are depressants, which basically have the opposite effect. So they depress the central nervous system. They slow your breathing down. The real danger with those drugs is that people tend to do a combination of them. So if people are taking one, they sometimes mix with another. So obviously the likes of heroin are sometimes mixed with methadone or Valium or similar depressants. And obviously the real danger is sometimes because they slow the heart rate down, it could get to a point where ultimately it stops the heart. So obviously a pretty fearful situation. Third type of illegal drug is obviously a hallucinogen. Slightly different. Physical addiction is not the problem, but they give ultimately really, really scary experiences, obviously, where people can hallucinate and have really out of body experiences. So not a very pleasant drug. Being addicted to something obviously means that it can cause withdrawal symptoms or ultimately a come down. And with the come down, obviously the reverse effect is that people would rather not have the come down, so it's easier to carry on or take the drug again and again. So rather than have the come down, they'll continue craving what they're doing. So ultimately that's where the cycle continues. So why do they become addicted? We do a lot of awareness sessions. So why do people become addicted? We do a lot of sort of employee awareness sessions, and we tailor these to sort of management or employee level. So we get a lot of feedback, and we have a lot of sort of direct conversations with employees, and they talk to us about experiences and where they might have had personal issues. We get a lot of quite worrying sort of situations, and they tend to open up. But some of the reasons we've heard back is that maybe they've had medical issues in the past, or they've heard of medical issues in the past. They've become addicted to a long-term prescription drug use. So they've ultimately been taken or prescribed codeine, for example, and they've just used it and continued using it because it's become a habit forming thing. So a long-term prescription drug use. The actual issue maybe isn't as big in the UK, but we see a lot of media coverage. You might have seen it yourself, but there's a lot of media coverage around in the in the US. There's a lot of issues with opioid use in the US. It gets prescribed quite frequently, and people get addicted to opioids, and it becomes a big dependency on it. Another issue sometimes is family history or family stress. So sometimes families can use and abuse drugs. Unfortunately, when families are like that, it can have a knock-on effect to other family members as well. So sometimes we hear quite sad tales from people when we're attending awareness sessions, where some families might be a lot more stressier in terms of an environment. Genetically as well, there are actually certain chemical reactions in brains that are more addictive than non-addictive brains. So that can explain sometimes why people can become addicted to substances, and other people don't become addicted to certain substances. And obviously stress, something I'm going to talk about a little bit more in the next few slides, but one of the most overlooked reasons why people abuse drugs is that their inability to cope with stress. Obviously, we know from the last 18 to 24 months, we've mentioned sort of COVID. Some types of drugs allow users to focus well. Other types of drugs allow people to use them as a type of crutch for really stressful situations. Work demands, I've mentioned COVID, but there's also certain industries that have had a real heavy demand in the last sort of 18 to 24 months. So work demands can often drive a person to keep using drugs as well and use them as a coping mechanism. So I'll talk about those in the next few slides as well. So stress and COVID-19, this slide really demonstrates how the stress of COVID-19 has had a massive impact on the use of drugs. I've got all the actual data for where I've grabbed these statistics from, but they're really, really interesting. Obviously, all of them have got details of how it's exacerbated drug and alcohol use. So I didn't catch that. Is that somebody speak there? No, that's fine. So there was in excess of 7,000 deaths from alcohol misuse last year. So a rise of 20% from 2019. Parental substance misuse was higher by 66% since April 2020. Maybe home learning had an impact on that, I'm not sure, but it certainly was stressful for me. Not to the point I was misusing substances, but it certainly had a massive impact on substance misuse. Alcohol abuse has increased, with the British Liver Trust reporting a 500% rise in calls to its helpline. Prescription drugs, illegal drugs and alcohol has risen as well since as a result of the COVID-19 pandemic. And cannabis smokers have increased their usage since the onset of the pandemic as well. So all of those has had an impact since COVID-19. Okay. So transport and logistics, it's one of our largest supplied industries. D.tec supply quite heavily into this industry, both from an educational perspective and obviously with the ultimately the drug and alcohol testing solutions that we supply. So I wanted to focus a little again on stress, mental health, and why potentially employees within this sector may, during the last 2 to 3 years, consider using drugs and alcohol as a bit of a crutch to support themselves. So the UK is currently facing one of the worst driver shortages today. Every day I'm talking to some of my key accounts, and they mentioned the fact that they've got a huge shortage. Nando's have got a chicken shortage apparently as well. Aside from the driver shortage, Nando's have had a chicken shortage this year. McDonald's have restricted their drinks menu. Arla Milk have cut back on deliverage. So the situation's not getting any better. Many retailers are holding their lowest stock levels as well. We're going to shops and they're struggling for stock. So aside from the shortage of HGV drivers, there's been an increase in demand for consumer goods as well. And we're having the knock-on effects of Brexit as well. We're also in the lead with the transport and logistics industry. We're coming up to obviously the busiest peak time for them as well. So we're going to see a massive increase for fresh produce, consumer goods, trees, toys. So it's not going to get any easier for the transport and logistics industry. So recently, the Haulage Exchange revealed that 50% of logistics companies have seen an increase in mental health issues, including stress and anxiety, and that's amongst their drivers. They haven't even mentioned the transport managers or the directors since the onset of Brexit. I just urge people to consider the challenges that their individual industries are facing as well. So employees aren't immune. So last year, 1 in 8 under 35s were using cannabis, and 1 in 14 of all employees were too. Most industries will be possibly thinking, and a lot of companies will be thinking, it wouldn't sound like their employees, but it's quite naive to think that. There's 74% of substance abusers are in full-time employment. And we mentioned cannabis. Cannabis nowadays is not the most harmless drug that people would potentially perceive it to be. cannabis nowadays, there's very, very high levels of THC and very low levels of CBD. So THC is the psychoactive element of cannabis and can create hallucinations and paranoia. The CBD element in the old style cannabis would counteract those effects, but the modern day skunk type cannabis has less CBD in it. We actually do supply to some mental health trusts, and they report back to us that many of their service user admissions, their units, are users of skunk type cannabis or have been users of skunk type cannabis. So it's quite alarming. So we genuinely feel that with what we supply, it's all about the education. So within workplaces, we obviously supply ultimately a lot of services, but with employees, it's really, really key that they're educated in the issues around drugs and alcohol, because they're very naive to the effects. Education is fundamental to preventing those addictive behaviours. People might be very open to the effects of alcohol because it's out there, but the effects of drugs not so. So education is really, really key for management awareness. Okay. So I'd always say, with that in mind, are you ultimately aware of the physical effects, not just the mental effects, but there's also physical effects for drugs and alcohol? I've popped those two little posters on this slide that we have here. We've got a whole wealth of sort of PDFs and educational posters that we can supply to businesses. So again, there's a chat box within the presentations that we're doing today. I'm more than happy to share these slides or share these posters if anybody wants access to them. So it's well known that across many industries, we've seen it again in press, employees are feeling undervalued, they're feeling overworked, they're feeling pressured, they're feeling challenged more than ever. We genuinely feel that they might, because of that, be sourcing coping mechanisms, and that might include drugs and alcohol. So we feel it's pretty key that HR have an open management and an open door policy to engage with their employees when needed, and have those conversations around, if there are issues, please talk to us. You know, we're here. The more tense employees feel, the fewer good brain chemicals they'll have available to them. So thinking's going to be less clear, and they potentially will be making those bad choices as well. So as an employer, how can you better support your workforce? This is just a little snippet, but we would always say engage as often as you can. Certainly with many of the safety critical industries we talk or supply to. Check in with your employees as frequently as you can, at the start and the end of the shifts, during the shifts, where possible. Have you noticed a difference in their appearance? Has that changed recently? If so, what's the reason for it? Punctuality? Are they on time for work? If they're not on time, has that happened recently? Why has that happened? Have a conversation with them. Minor mistakes that can be caused by lack of concentration or fatigue. Why has that happened? It's a great opportunity to ask more questions to try to get to the root cause of the problem. And it can also help to prevent more serious things happening in the future. Obviously, if there's been a minor incident, if they're driving a vehicle, for example, it can potentially prevent a worse incident in the future. So good stress management in the workplace is critical to an employee's overall health, and therefore employees should encourage their workforce, obviously, to take time out, basically. So working from home has created another issue as well. We potentially are not going to see those remote office workers. So we'd always suggest encourage employees to break up their day, take up yoga, Pilates, read more, take up exercise, have the half-hour walks, runs during their lunch breaks, and take a break from the screen as well. There's got to be a work-life balance. Don't work over contracted hours. Leave your emails alone in the evening. Take your annual leave when it's due, and obviously socialise with your employees as well. Grab a coffee for 10 minutes. All of these things are going to be really, really helpful to a good work-life balance. The sort of 4 steps that we work by for our framework is policy, educate, deter, and detect. And we genuinely place a firm emphasis on the education element. Even with CIPD, they'll state within their documents, with regards to drugs and alcohol, it's important that as employees you have a preventative and supportive measures in place, such as a fully scalable education program. So how can you actually expect your employees to understand the dangers without providing education on the topic? And that's pretty clear to us as well. So the final thing I'm just going to add, just before I close, is there is some companies that we talk to will always think, when they ask me about sort of resources for counselling services, or how do we provide education, how do we provide detail to our employees if they do ask for help. We obviously provide educational resources and services, and we'll help as much as we can. With regards to counselling, there are resources out there and in place that can be accessed without too much cost. Some of these resources are quite easy to access. There's no cost attached to them. Frank, for example, is obviously free for drug advice, and they all have workplace sections as well. Alcoholics Anonymous, Smart Recovery, and obviously there's localized NHS recommended services as well. So if anyone does feel like they need further support for their employees, then obviously all of these are easy to access. So hopefully that just gives you a bit of an idea of some of the strategies that can be used to support employees with stress management, and ultimately a bit of an insight into how you can help with addiction from occurring or worsening. But education, training and policy development are all elements of combating those addictions within the workplace, and that's what we can help with. So if you do need anything or you need any further advice or support, please just get in touch. And that's me. Thank you very much for your time, everybody.
Thank you, Gareth. Sorry, it would help if I came off mute, wouldn't it? I'm just checking chat and I can't see that anyone has any questions at the moment. Again, I'm conscious of time, so I will just open it up for about 30 seconds to see if anyone does have any questions, and then we will move on to Kate. And obviously, as Melissa has said in the chat, all of these presentations and the slides will be available on our YouTube channel. So we will be able to pass any questions that you come up with to Gareth and the other speakers as well. Yeah, so there aren't really any.
Thank you. I'll see whether I can get us back on time a little bit as well, because some key points have already been covered. So all being well, you should be able to. You'll probably see it in 2 elements because I'm on dual screen. Hang on a minute. There we go. Let's get it doing it properly. There we go. So thank you. It's lovely to be back at IOSH Chilterns, and lovely to be back with IOSH. So I'm going to talk to you about ISO 45003 today. it's just worth reflecting on the activity that BSI does in terms of the development of international standards. So I'm sure, as you're all aware, we developed the first management system standard on occupational health and safety, which morphed into 18,001, which was then the framework for 45,001. And it's that committee that has developed this standard, 45,003, but also took the guide that BSI wrote last year on safe working that got transformed into an international standard as well. And there's a huge amount of additional work going on within the technical committee coming through the pipeline are things like a standard that's developing the sort of 45,005 on COVID safe working to look at management of communicable diseases as a whole. There's a really exciting piece coming through around performance evaluation. So really looking at those proper leading as well as lagging indicators. So some great stuff going on, but we also do quite a lot in the wider people space. So diversity inclusion is a really good example, and we do a lot of work internationally. And I'd encourage all of you to get involved in standards development. You can do it when IOSH send out a consultation request, or you can do it directly through the standards development portal. The more people are involved, the more people comment, the better the standards are. So I would encourage you to do that. So just before I get into the detail of 45,003, I just wanted to make sure that we're all familiar with what stress is. I'm sure you all are, but it's important to understand the impacts, particularly of psychological health and safety. So stress is our natural inbuilt fight or flight mechanism. It's designed to keep us safe. It's an amazing thing. Allows us to do all sorts of incredible stuff. It's natural, it's inbuilt. We quite often don't even know it's going on. But the issue with stress is that if we are exposed to repeated stressors or stressors over a long period of time, including things like excess pressure, that starts to have much more negative implications. It can be sort of short-term, but also long-term, acute and chronic. We've heard really powerfully from James and also from Gareth that some elements of that affect our things like our use of substances and our eating, and that's really powerful examples of that directly. But from a physical point of view, the initial reaction with stress is it releases lots of chemicals that then has lots of related physical implications. So it gets our body ready for this fight or flight response. So we see it in things like flushing and sweating, muscle tension, sighing, feeling run down, and over time that starts to become problematic and cause issues like cardiovascular disorders, musculoskeletal disorders, a whole range. But from a mental point of view, the impacts that it has, and as Gareth said, there's an overlap here with some of the impacts of addiction as well. But at an acute level, it can make us feel nervous and anxious. It increases our emotional reactions. The cognitive impacts, and I think this is something that's really overlooked within a work context, is it can cause things like confusion. It impacts our ability to learn, to take information in, has impacts indecision, poor concentration, as well as loss of motivation and commitment. And that has really direct impacts on things like, the quality of work, productivity, and I think that's often overlooked. But of course, if this is not dealt with, then over the longer term it can lead to mental illness, so things like anxiety, depression, post-traumatic stress disorder, as well as related behavioural disorders, as I say, that James has very powerfully brought to life for us today. So why have I reflected on that? That's because when we talk about psychological health and safety, and we use the term psychosocial risks, so these are international terms that have been adopted because although we might use mental health or stress here in the UK, or work-related stress here in the UK, they don't necessarily translate very well internationally. So these are the terms that come from ISO 45003. But really the one of the key negative outputs of poor psychological health and safety management. So one of the harms that come from psychosocial risk is the stress response, and all of the implications that come with that. So psychosocial risks is the term that's been used internationally to describe what we might call in the UK stress risk factors. It's those things within the workplace that will affect a worker's psychological and social response. You can see psychological and social comes together there. And say one of the principal harms is stress, and where that is accumulative over time, it has a number of implications. But I think, again, one of the things that's often overlooked is that there's a very direct relationship with some forms of what we might call physical safety issues or traditional health and safety issues and psychosocial risk, and it goes the other way round. So there are obvious ones like some forms of physical risk, like violence, obviously will cause physical harm, but there will be mental harm that will come from that as well. The same with noise, musculoskeletal disorders, thermal discomfort. These often interact together, and we miss that when we're assessing and implementing controls. But again, just to reiterate the point that I made earlier, one of the implications of stress is the implications on our cognitive functions. So within the work context, that increases the likelihood of human failure or human error. And that has a whole host of implications across the whole of the business. Yes, it can increase the likelihood of health and safety incidents, but also it's likely and increasing the risk in other areas, whether that's quality, financial, governance, a whole range of things. So this is why, from a business point of view, it's not just about managing the sickness and the absence that comes from poor psychological health and safety. These have really direct implications on actually, the success and productivity of an organization. So what are psychosocial hazards? Haven't got time to go into all of this. I've touched on some of them, but these are the key ones. But I think one of the things, that really lays at the heart of this is culture, and that stems from leadership. And if we're going to make a real difference in terms of psychosocial risk and managing psychological health and safety in the workplace, you've got to address the culture as well as more direct stress factors. And I think one of the things that I've always found it really interesting and is that once you understand what these psychosocial risks are and the impact it has on people in an organization, you can almost see it. You can almost feel it when you walk into an organization. And this is some of the signs of exposure that are listed in 45,003. You'll see it in the behavioral change for people. I mean, again, a couple of powerful videos that were shared in terms of you can see a reaction to people. They might become more withdrawn. They tend to not look after their appearance. They may lose weight. They may put on weight because part of what they're doing is potentially behavioral and dealing with it in different ways. But you see it in other areas. So you see it in things like an increase in complaints or grievances internally, but also with customers. If people are unhappy and struggling or feeling that excess pressure, and they're having an emotional response, so maybe they're quicker to anger, or they're less patient, whatever it happens to be, then that will cause a reaction to whoever they're dealing with. And you see that come through in terms of, say, grievances and complaints. You might see more bullying and harassment directly, and understanding what some of the potentially underlying root causes of that are. So, there's a whole host of implications that come from this. So I think, it comes back to the question, why do organizations struggle to manage psychological health and safety? And I think it's really interesting. So I've been working as a health and safety professional for over 20 years now, and I started at the HSE. And in 2004, the HSE introduced the stress management standards. So a long time ago. This has been an issue for many, many years. Yes, COVID-19 has really shone a light on it, but this is nothing new. And I helped develop those standards, and I helped roll out and educate businesses, particularly things like the NHS and public service industries where occupational stress was a real issue. The stress management standards, great, really great tools. It's nice to see they're being a little bit reinvigorated at the moment. But organizations don't want to tackle it. And I think, there's a lot of it is associated with the stigma and discrimination that still exists around mental health, because, one of the outcomes of excess stress can be mental ill health. And then, we have our international standard here, and it uses the term psychological health and safety. We use the term psychosocial risk. These have common connotations associated with them, and, barriers that have meant that, organizers go, I don't want to deal with people's mental health. That's nothing to do with me. And of course, it's completely missing the point. So organizations, I think, have had the barriers that come from the stigma and discrimination and misunderstanding around mental ill health. And then within the context of work, they don't understand what these stress risk factors are. They don't understand what these psychosocial risks are. So they don't know what to do. So fundamentally, they don't do anything. So 45003 has been developed as an international standard, our first international standard looking at this subject, to really address those key points. Like all international standards, they've been aligned to relevant sustainable development goals. And as with all international standards, it follows the same high-level structure. So if you're using other international standards, 9000 on quality, 14 environment, or of course 45001 on health and safety, it follows the same structure. But this is a guideline document that has been designed as a practical how-to guide to manage psychological health and safety. It's been aimed to be accessible to everyone, for all types of sector, all sizes of organisations. And it was published in the summer this year, if you've missed it. And, it's great. It's so well overdue to have another toolkit. And I think, at an international level, there's been such a need for this. So to have a toolkit that starts to address this is fantastic. So this is, you can just see, this is the structure. It's aligned specifically to 45001, but with some key additions, which I'm going to come on to. So what does it cover? So as I said, it's a practical how-to guide, looking at how the leadership need to implement this at a strategic level within their organizations, but then of course how to recognize these psychosocial hazards, and it includes 3 tables of examples. It's nearly 3 pages. Actually, I look at this list, I can't think of much they haven't covered in terms of psychosocial risk. So you've got a brilliant aid memoir actually here about what these issues are. And it gives examples of effective and often really simple actions that can be taken. And it's of course based on the hierarchy of control, which is aimed at preventing this in the first place. So how does it link to 45001? So it's been designed to complement 45001. It's designed to support and complement it. 45001 does make reference to, if you look at clause 6, if you're geeky, to some forms of psychosocial hazards. So it references things like bullying and harassment, working hours, leadership culture, some of the important ones, but it doesn't use the term psychosocial risk. And there was a recognition at the committee, coming back to those 3 points, why don't organisations deal with it, that there's this huge gap in knowledge about dealing with this aspect. So they wanted to create guidance to go with it. So it can be used with 45001, that's how it was written, but it can be used without using 45001. It can be used as a standalone to look at psychological health and safety. But of course, because as I've mentioned, there's a very clear overlap between psychological health and safety and forms of what are called traditional health and safety risk, you can't actually manage psychological health and safety without having an overarching health and safety management system. It just doesn't have to be 45001. I think the other thing that's worth doing is a little bit of myth busting around competency. I think this again has been one of the barriers to organisations tackling this. I think there's a fear that because we're dealing with psychological or mental health, that you need to be a doctor in psychology or some sort of medical professional. You absolutely don't. This is about health and safety risk management. This is what we do day in and day out. You take exactly the same approach to identifying what's a hazard, looking at who could be harmed, how they could be harmed, the impact of that harm, the consequence, and then coming up with plans to do something about it, aiming to prevent it, and where you can't, mitigating it. What you just need to do is understand what these particular types of risk are. And we're all good at educating ourselves on that. You know, we didn't come into the profession knowing all the risks in all of our business. You know, so it's just a question of educating ourselves about this particular type of risk. I think one of the key differences, although I'd actually say this about a lot of if you like, traditional health and safety risks, is with psychological health and safety, you do need a much more cross-functional team, particularly kind of health and safety and HR coming together. You need health and safety because we understand how to assess health and safety risks, which is this is, but a lot of if you like, particularly the controls that you might put in place will come from HR, things like career development or behaviours and values, that sort of thing that underpin some of these psychosocial risk management needs will come, if you like, or live in the HR domain. So you do need a cross-functional team, and I'm conscious of time. So key additions, so, you know, health and safety management. One of the big challenges we have with psychological health and safety is that organisations have been focused on the individual. So I wonder how many of your organisations do an individual stress risk assessment when somebody says, "Oh, I'm feeling," you know, come up maybe and say, "I'm stressed." You do an, you know, might do an individual health and safety risk management. We do things like resilience training, personal resilience training. We focus on the individual. This is health and safety management. Health and safety management is about addressing the organizational causes, organizational risks, and doing something at an organizational level. And that is the focus of 45,003. It has to focus on diversity. The impacts of different forms of psychosocial risk are different for different groups. It uses the hierarchy of controls, but also introduces some new terminology: primary, secondary, and tertiary. These come from the healthcare sector in particular. Primary is like our elimination and engineering controls. They're the ones that aim at preventing it or bringing it or minimizing it to its lowest level. Secondary are our administrative and training policy processes, training awareness, all of those sorts of things. And the one that's different is tertiary. So how do you help and support people when they do become unwell? And then that links to the other really key addition, which is around rehabilitation and return to work. We all know the benefits of getting this right, so I'm not going to linger on that slide. The other thing with 45,003 is it provides an international definition of workplace well-being for the first time ever. And 45,003 is not a standard on well-being in itself. It is a standard on psychological health and safety management and promotion of well-being. If we manage the risks, we are going to improve well-being. That is the link. So, you know, it's great that we've got this definition. I think it helps give organisations some guidance about what actually really effective well-being programs look like. And at the heart of it, it's about creating trust within an organisation. And you can't do that if you're not managing psychosocial risks. So that's why that relationship is there. So then looking at broader wellbeing is about thinking about what the needs and expectations are of individuals, and help organisations navigate that. BSI has developed a new best practice model, which is a framework for those needs and expectations based on Maslow's hierarchy of needs. And I haven't got time to go into that, but I wanted to make you aware of it. So there's some guidance available. You'll have access to this. I'll pop some links in the box, and I'm going to stop there so we have a little bit of chance of questions. Oh, look at that, 1 minute over. Did you all keep up?
Thank you, Kate. I was going to message you and say it was fine if you went over a little bit. We do have a tiny bit of a cushion, but that's fine. Going back to something that you picked up on about why organisations don't want to get involved in this, something that I've found, particularly over the last 18 months, is that some organisations believe that where people come in to work and they've got things going on at home, you can't clearly delineate between home stresses and work stresses, and they don't want to cross that boundary and get involved. So I think that could be something that workplaces need educating on, because the two are inextricably linked, aren't they, really? So
yeah, I mean, it's I think again this comes back to the barriers, discrimination, misunderstanding around mental health. When we do health and safety, all health and safety risks, we have to take into account the individual and what they may be bringing into work with them. You know, I quite often use the example around fire safety. You know, that when organisations manage fire risks, they have to think about the organisational risks. So what can cause fire within an organisation, and then how to manage it. So they'll put in fire alarm systems, smoke detectors, then they'll train people to be fire wardens, and then they'll train everybody and practice doing fire drills. Now, within that group, there are individuals that might need temporary help or support in that last tiny bit of the risk in terms of the evacuation. So we do PEEPs, personal emergency evacuation plans. Might be temporary. Somebody might be on crutches because they've broken a leg. It might be something more permanent because they're in a wheelchair. You know, the easy examples, but you know, we do this as we have to consider the individual when we do and look at health and safety risk within an organization. This is exactly the same. This is no different. You know, and I think we need to overcome some of those barriers, and we need to recognize that this is about organizational causes. You know, and I think the link to well-being as well, more broadly, is that if we help and support people with whatever is going on in their life, you know, if we have bereavement, or we've got maybe we're dealing with cancer ourselves, or we're helping other people with cancer, you know, that will have an impact on our work life. But if our organization helps and supports us through that difficult time, we're going to appreciate that. We're going to feel more loyal to the organization, and I think, you know, we need to bring that to life more for organizations.
I did have one question come in. There's an individual that has said, all of this sounds great, but what about in a post-Brexit world where the organisation that you're dealing with might be a large corporation across a very large pond in a nation with a very different culture?
Are you talking about the United States by any chance?
I think we might be.
Yeah, so I think, you know, from my point of view, this is why ISO 45003 is important, because it's international. It has that status as an international standard. It means that for those global organizations, they can look at a single framework that they can implement globally to drive consistency. So I think that's, you know, that's a key piece. I think it's interesting in America. It is interesting in America. We've got a lot of clients in the US, and you know, they focus on wellness, they focus on the yoga, and it's driven from a very different point, particularly because of the health insurance. You know, organizations have to basically, the better organizations have to pay for their employees' health insurance. Health insurance companies will put the premiums up if people start going off with burnout, and then, you know, the organization goes, oh, this is costing us a lot, oh, we better try and help people. I think it's changing. I think they are very much a compliance driven culture out there. But the large international organizations recognize the impact that this has. And I think one of the things that we see, and I'm conscious of time and I'll talk forever, you know, out of COVID-19, and this really started in America, is the Great Resignation. People have had enough of not being looked after and not being appreciated, and they are walking, and it is putting the fear of God, excuse me if you're religious and you don't like that phrase, but it's having a huge impact on their business, because they are losing talent and they are not attracting talent, and it has all sorts of other implications as well in terms of innovation and creativity. And I think that penny's starting to drop, and they know that they can't buy their way out of it. They can't. Increasing wages is not the answer. So I think there's at least some recognition at the moment. I think that what will be interesting is to see whether that equates to a long-term change, or whether it's just a short-term reaction to deal with the challenge of the Great Resignation at the moment.
Okay, thank you very much for your presentation. Thank you for your time. I don't think there have been any further questions for you, but as I've said all along, if there are any more questions, feel free to pop them in the chat and we can get them to Kate, Gareth and James after the session and come back to you all. Okay, so we have a little bit of time for me to go through a couple of things. So we'll just go through a couple of updates. The December meeting for Chiltern will be the legal update. Details on that will follow. There won't be a branch meeting in January. We have regional networks conferences, so more details of next year's agenda will be sent out in due course. For those of you that weren't aware, Jimmy Quinn has now handed over presidency to our very own Louise Hosking, who isn't here with us today, but we wish her the greatest of luck for her upcoming year as president. I'm sure she'll smash it. And Lawrence Webb has also been sworn in as president-elect for this coming year. We've got three new VPs, Angela Abbs, Richard Bate and Joe Price. All were affirmed at the AGM on Tuesday. And as quite rightly has been put in the chat, Louise is Chiltern branch member and she's the ex-chair, so she's very close to our hearts and we love her dearly. So you heard me mention earlier that the Health and Safety Executive has launched Working Minds. There is a website, and we can make sure that when this slide goes out afterward, I can put the link in there after the presentation's finished. And obviously the IOSH main website for all of our branch meetings, webinars and events is the main website, and the link is in the slide there. We do have a LinkedIn page, so all the Chiltern events will be put in there. So please go ahead and have a look at that. I think that is everything we had to update you on. Yes, I just want to say thank you very much to our three wonderful speakers. It's been a very interesting and thought-provoking session. I'm sure everyone will agree. There's been some really amazing topics covered, and a lot to think about for many of us to go back to our workplaces. But thank you all for coming. I think we've managed to pull back 5 minutes, so thank you very much, and I wish you the best for the rest of your afternoons.
Hi, Natasha.
Yes.
Yeah, Melissa here. I just wanted to say thanks, if that's okay, just to the three presenters. I know I put it in the chat, but also to you and Tony for pulling together this session. I think it was very important. I know there's been lots of presentations on this topic. I know Kate's been doing a whirlwind tour, but I think for us in the branch, we felt it was very important for us to have the conversations as well on our mental health and well-being. And I do think personally 45,003 will give us some good guidance for organizations. So I'm looking forward to reading it personally. But thanks again, Kate, for that presentation. Thanks, Gareth, and thanks, James, for sharing your personal story. It's a really good session. Really appreciate it. Great job hosting, Natasha. Thanks.
Thank you.
Thank you, no problem.
Bye, everyone.
Thank you.
Right.
Goodbye,
Thank
everyone.
you, everyone. Take care.